Amlodipine side effects. Everything you should know. Amlodipine stands as a widely utilized medication for managing high blood pressure, a condition that places individuals at increased risk for serious cardiovascular events such as heart attacks and strokes. Belonging to a class of drugs known as calcium channel blockers, CCBs, amlodipine works by affecting the calcium channels in the body's cells. This medication is readily available in tablet form with common strengths of 5 mg and 10 mg. In both of these dosages, amlodipine is formulated as its salt, besylate. For those who have difficulty swallowing pills, an oral suspension form of amlodipine is also an option. Typically, the treatment regimen for amlodipine begins with a 5 mg dose administered once daily. However, for individuals identified as having a higher predisposition to cardiovascular complications, the dosage might be increased to 10 mg per day. Understanding the potential side effects associated with amlodipine is paramount for several critical reasons. Firstly, its mechanism of action directly impacts blood vessels. Since numerous vital organs rely heavily on the efficient and unimpeded supply of blood from arteries, amlodipine can consequently influence the functioning of a broad spectrum of organs throughout the body. Secondly, the therapeutic use of amlodipine often extends over prolonged periods, potentially spanning several years or even a lifetime. This long-term usage is significant because while some side effects may manifest rapidly and be relatively mild, others can develop more gradually and require vigilant monitoring, especially with extended administration. Thirdly, amlodipine is characterized as a long-acting calcium channel blocker. This prolonged duration of action allows for a convenient once-daily dosing schedule. However, it also means that the medication can persist in the body for extended durations and potentially accumulate with consistent daily intake. This accumulation can, in turn, lead to the emergence of certain side effects after several months of continuous use. Therefore, before embarking on amlodipine therapy, it is highly advisable to be well informed about its potential adverse reactions and to have a clear understanding of how to manage them effectively. This detailed exploration aims to shed light on these crucial aspects. The therapeutic benefits of amlodipine are primarily directed towards two main conditions. In individuals diagnosed with hypertension or high blood pressure, the arteries can become hardened, presenting a significant resistance to the smooth flow of blood throughout the circulatory system. This increased resistance elevates the risk of experiencing heart attacks and strokes in the future. Amlodipine effectively counteracts this by promoting the dilation of blood vessels, thereby reducing blood pressure and facilitating improved blood circulation. Beyond hypertension, amlodipine plays a significant role in the management of angina. Angina pectoris, often experienced as chest pain, arises when the heart muscle does not receive an adequate supply of oxygenated blood. This reduced blood flow can manifest as a distressing pain, typically felt on the left side of the chest and potentially radiating to the shoulder and neck. By dilating the coronary arteries, the blood vessels that supply the heart muscle itself, amlodipine enhances the delivery of blood and oxygen to these vital cells. This improved oxygenation leads to a reduction in anginal symptoms and contributes to better overall cardiac function. In essence, the underlying mechanism by which amlodipine exerts its beneficial effects in both hypertension and angina is the same. It blocks the process of arterial contraction, leading to a widening or dilation of the blood vessels. Calcium ions play a crucial role in the contraction of vascular smooth muscle. These calcium ions are primarily admitted into the cells through specialized pores known as voltage-gated calcium channels. Amlodipine functions by blocking these channels, thereby inhibiting the influx of calcium and preventing the arteries from constricting. However, this very effect of dilating blood vessels, while therapeutically beneficial, can also give rise to a range of side effects. These side effects can vary in their presentation and frequency among individuals. When considering the side effects of amlodipine, it is helpful to discuss them in order of their commonality and potential severity experienced by many patients. One of the most frequently encountered side effects is peripheral edema, which translates to swelling, most commonly observed in the ankles and legs. This swelling is directly related to the dosage of amlodipine, with higher doses leading to a more pronounced incidence of edema. For instance, the occurrence of swelling at the 10 milligram dose can be approximately 3 times more frequent compared to the 5 milligram dose. The physiological reason behind this is amlodipine's ability to dilate blood vessels. This dilation leads to a widening of the minute pores within the capillary walls, consequently increasing their permeability. This heightened permeability allows for a greater leakage of fluid from the capillaries into the surrounding tissues, leading to fluid accumulation. In the lower extremities, such as the legs and ankles, this fluid accumulation manifests as noticeable swelling. To help alleviate this discomfort, simple measures such as elevating the legs while sitting can be beneficial. Gentle massage of the affected areas and soaking the feet in warm salt water can also provide some relief. Furthermore, avoiding prolonged periods of sitting or standing can help to minimize the tendency for fluid to pool in the lower limbs. In many cases, leg edema can be managed with diuretic medications, which help the body excrete excess fluid. However, it is important to note that the edema induced by amlodipine is not typically caused by a systemic overload of fluid in the body, as seen in conditions like heart or kidney failure. Instead, it is primarily a localized effect resulting from the dilation of blood vessels and the subsequent leakage of fluid into the surrounding tissues. Consequently, diuretics may not always be effective in resolving amlodipine-induced leg swelling. Despite this, in many individuals, the peripheral edema experienced with amlodipine is mild and can be adequately managed through these physical interventions. In instances where the edema is more significant, a doctor might consider adjusting the amlodipine dosage or prescribing it in combination with other blood pressure-lowering medications, such as ACE inhibitors or angiotensin receptor blockers, which can help mitigate the fluid retention. Another common side effect reported with amlodipine is dizziness. This sensation of feeling lightheaded or unsteady may be noticed particularly within the initial few days of starting the medication. Some individuals might also experience a feeling of sleepiness or mild drowsiness. These effects are generally associated with medications that cause vasodilation in the brain, leading to a temporary reduction in blood pressure within the cerebral arteries. This drop in pressure can, in turn, result in feelings of dizziness and, in some cases, confusion. Fortunately, the dizziness induced by amlodipine is usually mild and tends to subside as the body adjusts to the medication over time. However, if you experience pronounced dizziness or drowsiness, it is advisable to avoid sudden changes in posture, such as standing up too quickly, as this can exacerbate the feeling of lightheadedness. Fatigue, characterized by a general feeling of tiredness and weakness, is another potential side effect of amlodipine use. This is a common occurrence with many types of vasodilating medications. Interestingly, the degree of fatigue experienced does not necessarily correlate with the dose of amlodipine being taken. Therefore, it can appear at any point during the course of treatment. Certain other medications or coexisting health conditions, such as diabetes, can also contribute to increased feelings of tiredness. However, it is worth noting that severe and debilitating fatigue is rarely reported as a direct consequence of amlodipine alone. Lifestyle modifications, including maintaining a balanced diet rich in fruits and vegetables, managing calorie intake, and engaging in regular physical activity, can often help to mitigate feelings of fatigue. Palpitations, a sensation of rapid or forceful heartbeats, can also be experienced by some individuals taking amlodipine. While amlodipine does not directly act on the heart's electrical conduction system or contractility, it can indirectly influence its rhythm. The underlying mechanism is related to how amlodipine lowers blood pressure by dilating the arteries. This reduction in arterial pressure means less blood is being pumped with each heartbeat to the body's organs. To compensate for this decreased perfusion pressure, the heart may respond by increasing its rate of contraction, leading to a feeling of the heart pounding or beating more rapidly. In some instances, individuals might also perceive occasional skipped heartbeats. This side effect tends to be more pronounced with higher doses of amlodipine, and it is reported to be experienced more frequently by women compared to men. Flushing, a sensation of warmth and redness in the skin, particularly on the face, can also occur. This is due to amlodipine's effect on the small blood vessels in the skin, causing them to dilate and increasing blood flow to the surface. Similar to palpitations, flushing is also observed more frequently in women taking the medication. A small number of individuals might experience mild abdominal pain or nausea while taking amlodipine. These symptoms are typically transient and may resolve as the body adapts to the medication with continued use. However, if severe abdominal pain occurs, it might indicate an underlying issue unrelated to amlodipine and should be promptly reported to a healthcare professional. Somnolence or excessive daytime sleepiness is another potential side effect that can be observed. This can manifest as a persistent feeling of being tired and drowsy, which can be further compounded by the dizziness and lack of energy sometimes associated with amlodipine use. This particular side effect appears to affect both men and women with similar frequency. While a primary goal of amlodipine is to lower blood pressure, in a few individuals, this reduction can become more pronounced when changing posture, particularly when standing up from a sitting or lying position. This phenomenon is known as postural hypotension and is a rarer side effect of amlodipine. However, it can lead to feelings of lightheadedness and dizziness upon standing. The risk of postural hypotension may be amplified if amlodipine is taken concurrently with other blood pressure-lowering medications. This can increase the likelihood of falls, especially in older adults. Therefore, if significant drops in blood pressure are experienced, it is crucial to consult with a doctor to ensure the appropriate adjustment of medication dosages. Headaches are also a common side effect associated with amlodipine use. The dilation of blood vessels in the head, a direct consequence of amlodipine's action, can stimulate pain receptors in the brain, leading to headaches. However, these headaches are generally mild and well tolerated by most individuals, often subsiding with continued use of the medication. A less common but noteworthy side effect is gingival hyperplasia, which is characterized by an overgrowth or proliferation of the gum tissue. This reaction is not universal among amlodipine users and is considered an idiosyncratic reaction, meaning it occurs in a specific subset of individuals who may have a particular predisposition to it. Other less directly related side effects can also be observed or potentially exacerbated by amlodipine. For instance, the risk of rhabdomyolysis, a condition involving muscle pain and weakness, is primarily linked to the use of statin medications, particularly at higher doses. However, when statins are used in combination with amlodipine, this risk may be slightly increased. It is important to emphasize that amlodipine, when used alone, is not typically associated with an increased incidence of rhabdomyolysis. Understanding these potential side effects before commencing amlodipine treatment empowers individuals to be more aware of their body's responses and to communicate effectively with their healthcare providers. This comprehensive knowledge ensures that the benefits of amlodipine in managing cardiovascular health can be maximized while potential adverse effects are identified and managed proactively.